Good morning, Sarah. Today, we'll discuss something very relevant to a lot of health concerns nowadays: fatty liver disease. Let's start with one of the earliest indicators that can suggest its presence: elevated liver enzymes. Are you familiar with what liver enzymes are?
Hi, Dr. Mike. I've heard about liver enzymes in my biology class, but I'm not really sure what it means for them to be elevated. What does that indicate?
Great question, Sarah. In the context of fatty liver disease, elevated liver enzymes often signal liver inflammation or damage. The liver enzymes we look at most closely are called ALT, which stands for alanine transaminase, and AST, aspartate transaminase.
How do these enzymes become elevated, Dr. Mike?
Normally, these enzymes are contained within liver cells. But if the liver is injured or inflamed, which can happen with fatty liver disease, the cells become damaged and leak these enzymes into the bloodstream, leading to elevated levels when we conduct a blood test.
So, is it always a sign of fatty liver if someone has elevated ALT and AST levels?
Not always, Sarah. While it's a common indicator, elevated enzymes can also result from other liver conditions, like hepatitis or alcohol-related liver damage. It's a clue, but further tests are usually needed to confirm the cause.
I see. How often should these enzymes be checked then?
For people at risk of liver diseases, like those with obesity, diabetes, or high alcohol intake, regular monitoring of liver enzymes through routine blood tests is advisable. This helps catch potential issues early, even before more serious symptoms appear. Understanding the role of liver enzymes is a good first step in recognizing the signs of fatty liver disease, as early intervention can significantly alter the disease's impact. Moving on to another sign of fatty liver disease, let's talk about fatigue and weakness. These are symptoms that many people might not immediately associate with their liver. Have you ever wondered how these could be connected to liver health, Sarah?
Yes, that seems a bit confusing. How does the liver relate to feeling tired or weak?
That's a very insightful question. The liver plays a crucial role in various metabolic processes, including glucose storage, metabolism of carbohydrates, and removal of toxins from your blood. When your liver is compromised, such as in fatty liver disease, these processes can be affected.
So, if the liver isn't working well, does that mean it can't manage energy production properly?
Exactly. If the liver is overloaded with fat and unable to function optimally, this can lead to an inefficient energy utilization and storage. The result is a persistent feeling of fatigue or general weakness, which doesn't seem to go away with rest.
That sounds serious. Are these symptoms enough to suspect fatty liver on their own?
Not quite, Sarah. Fatigue and weakness are very general symptoms and can be associated with many other conditions. However, if someone experiences these along with other risk factors like obesity or diabetes, it might prompt a doctor to investigate further for fatty liver, especially if other symptoms like elevated liver enzymes are present.
I understand. It seems like these symptoms are more like pieces of a puzzle that, along with other signs, could point to fatty liver disease.
Precisely, Sarah. It's all about looking at the whole picture and not just isolated symptoms. Monitoring and regular checkups can help in identifying these patterns early, which is crucial for managing conditions like fatty liver disease effectively. Next, let's discuss another symptom that can indicate fatty liver disease: pain or discomfort in the upper right abdomen. This is where the liver is located. Have you ever felt this kind of discomfort, Sarah?
Not really, Dr. Mike, but I'm curious, why does fatty liver cause pain in that specific area?
That's a good question. The liver itself isn't sensitive to pain due to the lack of nerve endings. However, the liver is surrounded by a capsule that can stretch. When the liver gets enlarged because of fat accumulation, this stretching can cause discomfort or a dull pain in the area right under the lower ribs on the right side.
How can someone tell if the pain is due to fatty liver or something else?
It can be tricky because this type of pain is somewhat nonspecific and can also be caused by other conditions like gallstones or kidney issues. However, If this discomfort is accompanied by other symptoms we've discussed, like elevated liver enzymes and fatigue, then it might suggest fatty liver, especially in someone with risk factors such as obesity or high blood sugar.
So, what should someone do if they experience this kind of pain?
It's important not to ignore ongoing abdominal pain. If someone experiences this along with other signs of fatty liver disease, they should consult their healthcare provider. The doctor might recommend an ultrasound, which is a non-invasive way to look at the liver and check for signs of enlargement or fat accumulation. Addressing this early can be key in managing the condition and preventing further liver damage. All right, let's delve into another significant sign that could suggest an advanced stage of fatty liver disease: jaundice. This involves the yellowing of the skin and the whites of the eyes. Have you learned about jaundice in any of your classes, Sarah?
Yes, I've heard about it. Isn't it related to bilirubin levels?
Exactly right. Jaundice occurs when there's an accumulation of bilirubin in the blood. Bilirubin is a byproduct of the normal breakdown of red blood cells. Normally, the liver processes bilirubin, which is then excreted through the bile. However, if the liver is damaged, as it can be with severe fatty liver disease, this process is disrupted.
How does this relate specifically to fatty liver disease?
In fatty liver disease, especially in the more severe form known as non-alcoholic steatohepatitis or NASH, the liver cells are significantly damaged and inflamed, which can impair the liver's ability to process and remove bilirubin effectively. This leads to jaundice.
What should someone do if they notice signs of jaundice?
Jaundice is a clear indicator that the liver is not functioning properly. It's crucial for anyone noticing yellowing of their skin or eyes to seek medical attention immediately. This symptom warrants prompt evaluation and management to understand the underlying cause and to prevent further complications. Managing jaundice involves treating the liver disease that's causing it, which may require a variety of approaches, including medication, lifestyle changes, and sometimes more intensive treatments depending on the severity of the liver damage. Finally, let's talk about the last point on our list, which directly relates to risk factors: weight changes and obesity. Obesity is a major risk factor for developing fatty liver disease. Can you think of why that might be, Sarah?
I would guess it has something to do with how fat accumulates, not just in areas we can see, like the belly or thighs, but also inside, around the organs.
Precisely. This internal fat includes what accumulates in the liver, leading to what we call fatty liver. Additionally, obesity often comes with other complications like insulin resistance, which can further exacerbate liver fat accumulation.
That makes sense. What about weight changes? How do they play into this?
Rapid weight loss can also be a problem. If someone loses weight too quickly, particularly through extreme diets or surgical methods, the liver suddenly has to process a large amount of mobilized fat, which can overwhelm its capacity and lead to fatty liver.
So maintaining a healthy weight is key. How can someone do that effectively?
Exactly, Sarah. A balanced diet and regular exercise are crucial. It's also important for those already affected by obesity or fatty liver to consult with healthcare providers to create a safe and effective weight management plan. Gradual and sustained weight loss can often help reverse fatty liver disease.
I see. So preventative measures and managing lifestyle factors are essential to avoid or manage fatty liver disease.
Absolutely, Sarah. Awareness and proactive health management can make a significant difference in preventing fatty liver and maintaining overall liver health. Thanks for taking the time to discuss this important topic with me today.
Thank you, Dr. Mike. I've learned a lot about fatty liver disease and the importance of keeping an eye on these signs and symptoms. I'll definitely be more mindful of my health choices moving forward.
You're welcome, Sarah. Keep up the great work in your studies and in managing your health.